All right, we are live stream right now. Hello, everyone. Welcome back again to my YouTube video channel. I am honored and excited to have my friend, Dr. Mike Morris, one of the fellows at the International College Dentist I met recently. I just get so much impressed how the work that he shared with me. And I say, I have to get me on my podcast channel to at least show young dentists and dental students what kind of dentist that we can do for our patients. And Dr. Marmel, he got a lot of stuff that I'm so impressed. But the most important thing is we have some common things that I want to find out. Dr. Marmel, how did he become who he is? He's doing in his classes, he does TMJ and he does multiple types of the work that he do. I just want him to be the one that introduce what do you practice in your office, Dr. Morris? And
Well, I practice
before you
in
do that,
Burlington,
tell us a
Vermont.
little bit, who you are,
Yeah, so I'm Dr. Mike Morris, and I actually went to University of California in San Francisco, and I actually practice now in Burlington, Vermont. And we share a common mentor, Dr. Larry Tabor. And I met Larry Tabor when I was in dental school, actually, and he brought me on several mission trips with the Flying Doctors. And I had a really great experience with Dr. Tabor, and he mentored me and taught me how to do oral surgery. And he got me really excited about implants. He actually encouraged me. I went on and took more training. I did a residency and learned how to place implants. And it's doctors like Dr. Tabor who are very influential, I think, and can help young dentists. And I think that that's what I felt attracted to come to this podcast and to be able to do this with you, doctor, because I think this is great for young dentists, and it could be really encouraging and it can be uplifting and inspiring for young dentists to know what they can do and to feel empowered.
absolutely. So I remember your story where that before you even become a dentist, you have a chance to come with Dr. Larry Tabor on the missionary trip to Mexico. Or is that what the story is about? Can you tell us a little bit
Yes.
about? It's really interesting because a lot of students young dentists or young college students sometimes they want to figure out whether they really want to do dentistry or not. And your story is really like interesting to help people that really, if they want to do dentistry, first they have to really experience what real dentistry is about, right? So can you share with the audience, how did you know that the Larry Tabor, one of the legend that volunteer dentists that he do more than 100 fly to Mexico every year and do dentistry and just the story of being a compassion dentist like Larry Tabor and how a young dentist when you were a young dentist student, how did you get to know him and just the whole thing? I'd like to understand that so students understand more, you know.
Yeah, thank you. Thank you so much. Yeah, so I actually was trying to learn more oral surgery in school, and I didn't feel like we had a really great exposure to oral surgery. And so I was actually going on my extracurricular time, and I would go to the general hospital and I would try to hang out with the oral surgery residents and learn more oral surgery. And actually, I think it was one of the oral surgery residents. Someone told me, well, you should do a dental mission trip. You learn a lot of oral surgery there. And so I thought, well, how am I going to find that? How would I know where to do a dental mission trip? How does that work? So I started Googling and I found the Flying Doctors, Los Medicos Voladores. And I thought, oh, okay, well, they do trips in Fresno and such. It's not that far. I could drive there. So I contacted them and they said, well, and this was years ago. Now they have dental students that come to all their clinics. But I was one of the first, as far as I know, I think I was the first one to reach out. And I said, oh, I'm a dental student, but I want to come and I want to volunteer. And they said, oh, I don't know if that's allowed. I don't know that we just usually have, licensed dentists. So, let me hook you up with someone that can answer your question. So they actually linked me with Dr. Larry Tabor, who I was unaware was a leader in the Flying Doctors, sort of the primary leader in the Flying Doctors. And Larry got on the phone with me and he said, why do you want to do this? And I said, well, I just really want to learn. I want to learn and I want to start to give back because I grew up poor and I didn't have access to dental care for much of my younger life. And I know how hard it is. I grew up with a single mom. And so, it was not just that I wanted to learn, but I also wanted to start giving back right away, even just being in dental school. And so Dr. Tabor said, well, all right, you can come and you can do these dental mission trips with me, but you're going to practice under my license. So I'm going to be responsible for you, so I'm going to, make sure that you stay out of trouble. And I said, okay, that sounds great. So he put me in his plane and flew me down to Coachella. So the Inland Empire area, Coachella Thermal. And we did a mission trip in a high school gym. And I extracted my first tooth and my 50th tooth in the same day. And, most dental students at that point, when I was in school, was extracting about 50 teeth total their entire time in dental school. So it was a pretty great exposure and experience to be able to actually have that much exposure in one day. So I fell in love with it. And, on our flight back, Larry was saying, so, you think you want to do this again? And I said, absolutely. When's the next clinic? And he said, well, we're doing a clinic in Fresno. And I said, great. I've never been to Fresno. I'd love to go there and do that. So I've done I think it's been about 8 mission trips now. And unfortunately, Dr. Tabor passed away last year. And in his honor, they had a reception and they had ceremony for him at the last year's, every September, they do the Coachella mission trip. And they had this whole celebration for him. And his family was there. And so I found out that he passed away in July. And I actually bought a ticket and I had to take 2 connecting flights, or I should say, 3 flights total to get from Burlington, Vermont to Coachella. And I bought a ticket about less than 8 weeks in the future when I found out that he passed away. And I made it to that clinic and I was able to see his family and pay my respects. And yeah, Larry was just very influential. And I think it's really great that you have this channel. And I think it's so important to understand that, just one person in your career or one person in your journey can have so much impact.
I agree with you. You mentioned that to the mission trip you've done hundreds hundreds of extractions. Is that right?
Oh, I mean, I did probably 50 extractions in one day. Yeah, myself as a dental student, Um, and so, I mean, the other docs, the more experienced doctors, were doing probably more than that. And the amount of dentistry they gave away is in the hundreds of thousands of dollars worth of dentistry. I mean, I think in one clinic we gave away like $250,000 worth of dentistry.
It's amazing, for those of you understand that in order for us to become a good dentist, reinvent our missionary trip, whether it's internationally or domestically, it's a way to improve your skills. And, that's on my note. It's amazing of your mission. Could you tell us what do you practice daily? What are your allocations? Besides, regular type dentistry, I know you teach advanced stuff, TMJ, for example, and all kinds of things. So we look a little background, like how did you get involved in these things?
Well, it's a very personal story. Actually, myself, I had TMJ issues. I remember in dental school, we were learning about bruxism, which is clenching and grinding. And I thought, well, I do that. I never really thought about it, but I do that. And then we talked about clicking and popping and stuff. And I said, well, I have that. And the more I thought about it, I thought, well, I think I have TMJ, TMJ disorder, that is. And so I had some treatment and I started, wearing a night guard right there in dental school. Um, and I started with some soft night guards and I had a hard night guard. And I would chew through them or they would be uncomfortable. And I had treatment from someone who called themselves a TMJ specialist. And I woke up, it lasted a few years. I woke up one day, a couple years after I had treatment with this so-called specialist, and I woke up with my jaw locked in the appliance that they had made me. Um, and so I thought, well, I actually was just a brand new practice owner. I had owned my practice about 3 months and, had bills to pay and overhead, family. And I woke up with my jaw locked, and my wife had to call my office and tell my staff to cancel all my patients because I won't be in because I have this problem. And I thought, okay, now it's time, to really figure this out, I think, because TMJ issues and jaw pain, especially lockjaw, can really be, disabling. And so, long story short, I actually found a really good mentor who not only treated my issue, but actually helped me to learn. And I actually was able to start to learn and train. And this was many years ago now. And so I said, I want to do this. I want to do this type of treatment for my patients. And so that's where I am today. So that's how I got into this type of work. And, you know, those are some of my cases. Those are some of my full mouth cases. And, it's really life changing. I practice what I call kind of bread and butter general dentistry for over 2 years. I worked for someone else. And it was, it was gratifying in its own means, but I knew it wasn't something I wanted to do forever. I wanted to do something that had more impact on a patient's life, not just a tooth or a procedure. And, I've had dental pain, I've had root canals, I've had other issues, but to actually change someone's life, this type of treatment that you're seeing here on the screen is life-changing treatment. These people, um, they aren't just having a small problem that's then, you know, dealt with, and it's not something that bothered them, for a little while. It's something that they might not have even known was going on, and a problem that was just a chronic issue that they didn't even know how much was harming them or how much was affecting them until after it was corrected. And then they really felt that life-changing impact and the quality of their life improved. So
Yes, the work that you do is amazing. I saw some of the work that you do, I saw that you do, even expanding the caliber and everything. A lot of stuff that I can't wait for the next video. We're gonna do a little bit deeper into the work that you're doing and the case that you have with your patients. Like you said, life-changing experience. And so I see on your website you even have a referral form for other dentistry where you can use some kind of treatment. And you did so that presentation to local prescription private practice, physical therapist, just to help them understand how you can collaborate the work that you do together. Um, it's hard to do a one-man show, but together as the community of healthcare provider, we can get together and improve one case to another, and that's how it should be, right? So,
absolutely. Absolutely. Yeah. And I'd love to share and show you what you can do with dentistry because I think that that's the most empowering. When I learned from my mentor what could be done to help other patients like me, I mean, I felt immediately empowered to want to learn how to do that and how to help other people the way that I was helped. And it means more when you're a patient too. And so, just the capability that we have with this profession and what we can do with it is really amazing, and it goes so far beyond just basic treatment of dental cavities or gum disease. We can do so much more.
These the audience, the student, dental, dentist, young dentist, or even seasonal dentist, some kind of, I mean, we talked a little bit about the treatment that you do. You talked about the bite, and the bite is not right, and the whole,
So yeah, the way that I explain it to my patients is that, the teeth are part of the orthopedic system of the body. And so the teeth are part of the skeleton, simply. And so the orthopedic system will compensate if there is issues with another component. So in other words, if you were to dislocate your shoulder, that would probably change the way you walk. That would change the way you carry yourself. That would change the way you just move the rest of your body. If you break a toe, that would definitely change the way you walk, the way you move. And so the thing about it is the teeth are just as important, if not more important. And I can show how if we actually stabilize the bite and we actually give a good orthopedically stable and healthy bite, that can actually help our head and neck posture. That can help the pain in our neck and our head, the pain in our jaws. That can actually even improve things like breathing because we actually stabilize our breathing with our teeth. It's very easy to understand that we talk with our teeth. Everyone always thinks, well, of course, we eat with our teeth. We think about teeth, we think about eating. That's great. But if you notice, and if you hear someone that doesn't have teeth speak, you can immediately tell that they don't have teeth by the way that they're speaking, because our teeth help articulate our words. But what many people don't understand is that we actually breathe with our teeth too. Our teeth help to support our breathing. And if we're not breathing well, then that will affect our teeth. And if our teeth are not working well, then that will affect our breathing. So that's just a really quick and sort of summarized version of what we can get into. We can break everything I just said down into individual, concepts, and we could talk about each concept, which I think might be interesting to your audience.
yeah, absolutely. So, can't wait next time. I know it's kind of late for your time ever remind. Dinner is ready, but next time, Mike, we're gonna come in deeper presentation, and very nice to see you in the podcast, and I can't wait for you to present more case, complex case to my audience. They're lucky to follow you.
Awesome. Yeah, I would love to do that. Thank you so much.
Have a good one, brother. Take care. See you.
Thank you so much.